Hi, I'm Joe Graydon.
I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy, where we bring you the stories behind the health headlines.
This podcast is brought to you by Redix Industries, makers of Utterly Smooth Body Cream. 800-345-7339, on the web at uttercream.com. When your allergies are acting up, it's hard to breathe. Now that pollen is in the air, what can you do to ease your symptoms? This is the People's Pharmacy with Terry and Joe Graydon.
Sneezing, wheezing, congestion, and red, itchy eyes are surefire signs of hay fever during this allergy season. But it's not just your nose, eyes, and lungs that suffer. Brain fog is a common complaint of allergy sufferers, and some medicines can make it worse.
What can you do to prevent or treat troublesome allergies? We check in with the experts and offer you up-to-date information on medications and non-drug options.
Coming up on the People's Pharmacy, tips for surviving the sneezing season.
First, this news.
In the People's Pharmacy health headlines, a Mediterranean diet heavy on extra virgin olive oil has just been shown to significantly lower the risk of malignant breast cancer. The research, published in JAMA Internal Medicine, is an extension of a Spanish study called PREDIMED. 3 years ago, the first phase of the trial demonstrated that a Mediterranean diet supplemented with either nuts or 4 tablespoons of olive oil daily could reduce the risk of heart attacks and strokes. In the spring of 2015, a second phase of the study revealed that compared to a lower-fat diet, the Mediterranean diet with added nuts or olive oil could help reduce the risk of memory loss and cognitive decline in older people. Now, the same high-fat Mediterranean diet has been shown to impact the risk of developing breast cancer. The Spanish investigators randomly assigned about 4,000 women to either a low-fat diet or a Mediterranean diet, plus 4 tablespoons of extra virgin olive oil daily, or the same diet plus an ounce of nuts daily. After nearly 5 years, the women following a Mediterranean-type diet with 4 daily tablespoons of extra virgin olive oil had a 68% lower relative risk of being diagnosed with malignant breast cancer compared to the control group following a lower-fat diet.
Myopia, or nearsightedness, has become an epidemic eye problem among children in East and Southeast Asia. This focusing problem has also been increasing at an alarming rate around the world. In the U.S., myopia has grown from roughly 25% of teenagers and middle-aged people in the early 1970s to over 40% by early 2000. In China, the rate of nearsightedness among children is substantially higher. Some urban areas report that 90% of high school graduates have myopia.
A new study suggests that outdoor activities may impact the development of this eye condition. Chinese researchers recruited more than 1,900 first graders from 12 primary schools. Half the schools maintained their traditional class schedules, while the other half extended the time spent outdoors by an extra 40 minutes each day. Compared to the children in the control group, the kids that got extra outdoor time had a 23% relative reduction in myopia after 3 years. Perhaps it's time for children all over the world to spend more time in outside activities at school and playing outdoors when they get home, instead of just texting or watching a video screen.
Low levels of vitamin D could be bad for your brain. Researchers tracked cognitive function and memory in 318 adults for about 5 years. Their average age was 75, and roughly half had some degree of cognitive impairment at the start of the study. The scientists also measured blood levels of 25-hydroxyvitamin D, a measure of vitamin D status in the body. Roughly 25% of the subjects in the study were deficient in vitamin D, meaning that their levels of 25-hydroxyvitamin D were below 12 nanograms per milliliter. More than half of the volunteers were low in vitamin D. The lower the levels of vitamin D, the greater the decline in both memory and cognitive function over the 5-year assessment period. The authors conclude that low levels of vitamin D may correspond to an elevated risk for dementia. What's unknown, however, is whether taking vitamin D supplements could prevent or slow mental decline.
An ingredient in red wine, grapes, peanuts, pistachios, blueberries, cocoa, and dark chocolate may be good for the brain. Researchers randomly assigned more than 100 men to take a purified extract of resveratrol or a lookalike placebo. The subjects in the study were cognitively impaired, having been diagnosed with mild to moderate Alzheimer's disease. At the end of a year, the men getting resveratrol performed slightly better on activities of daily living. They also had higher levels of beta amyloid in their spinal fluid, suggesting that resveratrol might be helping clear this brain-clogging protein out of the central nervous system where it's associated with Alzheimer's disease. The dose of resveratrol used in the study was far higher than the amount one could get from wine or chocolate. Nevertheless, the results are promising enough that scientists are planning a more rigorous study to see whether high-dose resveratrol might slow cognitive decline associated with aging. And that's the health news from the People's Pharmacy this week.
Welcome to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. If allergy season hasn't yet arrived in your hometown, it's not far off. In the fall, pollen from plants like ragweed makes a lot of people miserable. Sniffling and sneezing, suffering from congestion and itchy, watery eyes. Not to mention the post-nasal drip that can drive a person crazy.
To help us figure out how to handle allergy symptoms now that the sneezing season is underway, we turn to Dr. James Sublette. He's a board-certified allergist in practice in Louisville, Kentucky. He's the managing partner of Family Allergy and Asthma in Louisville, and he's the current president of the American College of Allergy, Asthma, and Immunology.
Welcome to the People's Pharmacy, Dr. Sublette.
I'm happy to be here today.
Thank you for joining us. It seems like just about everybody is allergic these days. If they're not allergic to pollen, they're allergic to cat dander or house mites or something or other. Why is everybody allergic? Or is this just a phenomenon that we have been dealing with for centuries?
Well, it's actually a little bit of both. The incidence of allergy is around 1 out of 4, 1 out of 3 individuals. It may be higher in children. And there has been what we term as an allergy epidemic, which has been occurring for the last 30, probably up to 50 years. I think it takes a while before you notice these trends, but certainly in the last 20 to 30 years, there's been an exponential rise in just about all allergic diseases. And this is a worldwide phenomenon, not just something happening here in North America.
Now, we often think about allergies as sniffles, sneezes, congestion, but some people really have problems with their eyes, itchy, runny, and some people say, I just get super spacey. My brain doesn't work very well, and I'm having an allergic reaction. Do some people react differently?
Well, there's a number of different types of manifestations of allergy. What you described is typical for what we term allergic rhinitis, or what people commonly would call hay fever. There's a misconception that hay fever is limited only to seasonal allergies, but actually 2/3 of people that have their upper respiratory symptoms will have it year-round. Another most common type of allergic manifestation we see is asthma, and actually about 10% to 12% of the population has asthma. 85-90% of the time this is due to allergic triggers. If you look back, I've been in practice about 35 plus years now. At that time, the data was around 4 to 5% of the population. So there's an area we've had nearly doubling in the past 30 years. Another common problem is what we call atopic dermatitis, which would be skin rashes related to allergy. Then you can break it down to the types of allergy, be pollen, mold, dust mite, animal allergens, and certainly food allergy has been on the increase, and particularly peanuts in kids can increase. It's been nearly doubled in the last 20 years. Now, the symptoms, when you feel bad, you can really feel terrible, and that can affect your ability to concentrate and just do normal day-to-day activities, especially if you have either the respiratory allergy, the upper respiratory, or if you have asthma.
Dr. Soblet, do we have any idea why there's been such an increase in allergies over the last few decades?
Well, there's a lot of factors involved. One is we've moved away in the last 100 years from communicable diseases to non-communicable diseases. So we've moved away from people having problems with, for instance, in the 30s and 40s, children actually still died of things like strep throat. So as we've done a better job in developing both public health initiatives and treatment of those diseases, there's been a switch over in the immune system to more allergic phenomena, and that's where you see this exponential rise of not only allergic diseases, but other non-communicable diseases like autoimmune diseases like rheumatoid arthritis and those types of diseases, cardiovascular diseases. Now, you can directly link most of this to lifestyle issues. Cigarette smoking would be a significant part of this, indoor and outdoor air pollution, but also self-selected lifestyle like diet and obesity being a major factor in the development of a lot of these non-communicable type diseases.
Now, you mentioned indoor-outdoor air pollution, and, when people think about that, they think, nasty toxic chemicals that are sort of floating around. But in point of fact, some of our buildings have become so airtight that any chemicals in the carpet, for example, might be able to get into the air, dust into the air, and we don't necessarily have good filtering systems in some of our workplaces and oftentimes at home. So let's talk a little bit about, I guess, what you would refer to as allergens, things that would precipitate an allergic reaction, and how we can begin to identify what's at fault and then remediate. Because it's so easy to take a pill. It's so easy to you get out an inhaler. It's so easy to get shots. But what about the source of the problem, the allergen itself?
And you're correct. That's a very important aspect of treatment. Actually, as allergists, we're trained to identify and discuss with our patients these various triggers. So focusing on the indoor environment, I've already mentioned the number one indoor pollutant we have is cigarette smoke. And unfortunately, that still tends to be a significant factor in many, many families. Then the building issues you mentioned, tight buildings, both commercial and homes. With the energy crisis that came along in the 70s, there was an attempt to increase energy efficiency. And by tightening up our buildings, especially older buildings that maybe were built with natural types of ventilation, like large schools that have open windows, and now they're tight, their windows are sealed, and there's no real way to ventilate those buildings where you have good airflow. And you need air circulation in and out of the building. And so there's it's kind of like inhaling and never breathing out. These buildings, they inhale, and the air from both outdoors and what's being generated indoors, and it gets trapped in the indoor environment and builds up over time to where it can become a factor both from an irritant standpoint and or an allergen standpoint.
What's the difference between irritants and allergens?
That's a good question. The allergens actually elicit an immune response, or allergies as we would commonly call it. And those are things like dust mites, animal allergens, which are found in all the sources from animals. So it's not just their hair or their dander. It's actually anything that animal generates can potentially have these allergens because they're at a biochemical level. So, the common pets like dogs and cats are included, but we also have exposure, especially in schools and buildings and even homes, buildup of mice allergens. And then there's these pests like cockroaches and potentially other bugs that can become allergens in the indoor environment. Ladybugs have been reported as an allergen. So these things build up. And then also mold, which primarily comes from outdoor sources. Most of your mold exposure actually occurs if you're outdoors. Maybe you're doing something like raking leaves or walking through a park on a windy day. But if the mold gets inside and there's a good environment for them to grow, for them, not necessarily us, they will take up residence and start growing in damp environments, on substances like wallboard or carpet or, stored cardboard or paper, things like that.
Well, speaking of mold and mildew, we live in the South, and there are a lot of houses that have crawl spaces. And that crawl space is open to the outside, so when it's hot and humid in the summer, there's a lot of opportunity, plus there may be heating and air conditioning units that are dripping, and so that crawl space becomes a wonderful breeding ground for mold and mildew that then can get sucked into the heating and air conditioning system and basically blow throughout the house. What do we do about that?
Well, that's an interesting and very good observation. Actually, in hot, humid environments, it'd be better if crawl spaces were not vented to the outside. So one thing you can do is seal your crawl space. If you think of your home as from the roof to the bottom of the house, including the crawl space, or if you have a basement or concrete floor below that. So what happens in these crawl spaces you described? That hot, humid air comes in and it'll hit a cold surface, and the cold surface often is your floor, because you air conditioned your home and the floor is cool compared to the hot, humid air in the crawl space. So you get condensation of the moisture at that point, and you can then get mold growing on the bottom of the floor and the wood. So one solution is to seal the crawl space and actually vent the crawl space to the indoor air, or have a way of conditioning the crawl space. And this may require a little bit of help from your HVAC people. But that's a common problem. Also, in attics, you can have the same issue where the attic may be hot and humid and get condensation on the ceiling. So it's better to insulate the roof and not the ceiling necessarily. So this is where you get, a good contractor who understands how this all works can help you.
What's the relationship between allergies and asthma?
Asthma is an allergic disorder in most individuals, especially in children. It's estimated that probably 90% of the triggers are due to allergic trigger in asthma. Over 50% of asthma, or maybe 75% of asthma, starts in childhood. But even adults who develop asthma often have underlying long-standing allergy problems. So asthma is a manifestation of an allergic disorder.
You're listening to Dr. Jim Sublett, President of the American College of Allergy, Asthma, and Immunology.
After the break, we continue our discussion with Dr. Sublett to learn how to identify allergy triggers like dust mites. Find out how effective allergy shots can be. Is immunotherapy for you?
You're listening to The People's Pharmacy with Joe and Terry Graydon.
If you like this podcast of The People's Pharmacy and want to continue the conversation, you can join us online at facebook.com/People's Pharmacy to share your thoughts or comments.
Welcome back to The People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. The People's Pharmacy is made possible in part by Red X Industries, makers of utterly smooth creams and lotions that deeply moisturize to make dry skin feel soft and smooth. The number's 800-345-7339, online at uttercream.com.
If you would like to order a CD of this show, you can call 800-732-2334. This is show number 1006. That number to call, 800-732-2334. Or you can place the order online at peoplespharmacy.com.
Today we're talking about allergies. Just because they recur predictably at the same time every year doesn't make them any less miserable, and some people suffer all year round. What can allergy sufferers do?
Our guest is Dr. Jim Sublett, President of the American College of Allergy, Asthma, and Immunology. He's a board-certified allergist practicing in Louisville, Kentucky, where he's managing partner of Family Allergy and Asthma.
Dr. Sublett, a lot of physicians who get a little bit of training in medical school when it comes to allergies think about medications. I mean, it's like, okay, we have antihistamines in our arsenal. If that doesn't work, we can go to the corticosteroid inhaled sprays. They're now available over the counter for allergies. Drugs like Flonase and Nasacort would be two examples. Then you have the decongestants. So there are all of these different treatment modalities. Very few physicians have time to think about avoidance. It's like, okay, we're going to send a team out to your house and get down in the crawl space, and we're going to look upstairs in the attic, and then we're going to check out the bathroom, and we're going to look under the bed for the mites. I mean, we're going to send out a team of sleuths to find out what's going on in your house. That doesn't happen. It's like, here's a prescription. So how do we start with avoidance and then move on to the medications?
Well, it's hard to do sometimes because, as you mentioned, very few physicians are actually trained in allergy, and oftentimes they, even a pediatrician or internal medicine physician may only have just a few lectures or a very brief contact with an allergist in their training. I mentioned earlier that approximately 1/4 to 1/3 of the population, to 25-30% of people have allergies. Of those people, about half will self-identify if you ask them that they have moderate to severe problems. That means it's interfering with their day-to-day lives. They're missing, kids are missing school. Maybe people have recurring sinus infections, and they're being treated with antibiotics when actually it turns out to be more of an underlying allergy. People have recurring bronchitis, which is certainly abnormal for a normal adult to have more than an occasional episode of bronchitis or sinus infection. So if you're having things like that happen, it's worth checking again with either your primary care or direct referring now to a board-certified allergist. So once we see a patient, we can then help identify what that patient may be allergic to or what the underlying triggers are.
How do you identify those triggers?
Well, the best and most accurate and still a gold standard after many, many years of doing this is through specific allergy skin testing, where we'll take, for instance, dust mite, and you do a prick test on the patient's back usually, and they will have a wheal and flare, we call it, or a bump comes up that identifies that they are sensitized to that allergen. So we can do this to any variety of the allergens that are recognized as the triggers or the underlying allergic cause for allergy problems. So once you've done that, say you have a patient comes in, they have dust mite allergy, maybe they have an allergy to a couple of mold spores, they have some pollen allergy, then there's certainly animals like cats and dogs can be positive. So then we will take that result and customize an avoidance plan for that patient.
Are these tests reasonably accurate?
They're very sensitive to the point that sometimes if you randomly do this without having a reason, for instance, if you just drug 100 people in off the street and said we're going to do skin testing, you'll find people that have positive prick tests and not really have any significant clinical problems. So it's important to correlate their history and how severe their problems are with the results of the test, like any type of test, whether it's a lab test for other types of disorders too. You see the same phenomena where sometimes they may have a positive lab test and it doesn't really relate to what their daily symptoms are.
Let's say somebody reacts to dust mites, and it's our understanding that they're not actually the dust or the mite, it's the mite poop that is causing the allergic reaction, and so as a result, you've got to do some things. We've heard you need to get the right kind of mattress, you need to have the right kind of furniture, you need to get rid of the carpets.
Can you tell us what are actually the best tactics for controlling dust mites for someone who has that allergy?
Yeah, dust mites, there's been a lot of work done on this, and certainly there's fairly simple measures you can do. Most of the, as you just mentioned, most of the mite allergen, which comes from anything from that mite, just happens a mite feces has a lot of the high concentration of the allergen. So the mites live inside, down in the mattresses, and they live in pillows, and they can get in stuffed animals, and they'll migrate in and out the inside to the surface. They don't bite you, they don't cause any problems, but they cause allergies. So what can you do? Just washing the bed linens weekly, that falls within the mice life cycle, and that can be a significant game changer. And we used to say hot water, but there's now been studies showing that just regular washing can make a difference. You should encase your pillow and encase your mattress in a mite-proof encasing. Now, the problem there, it has to be a tightly woven encasement, and it doesn't have to be plastic. A lot of times people think they have to sleep on a plastic bag, but there's new, very tightly woven type of encasings that can be put on mattresses and pillows. Unfortunately, they're relatively expensive, but if you look at the cost compared to maybe one round of an antibiotic or a month's worth of an inhaler or other allergy medications, they're relatively inexpensive, and they're a one-time proposition. So those two things are very important, the washing, not necessarily hot water, just regular washing, and then the encasements. The third thing, just generally in the bedroom, is to have a smooth surface furniture that you can wipe down easily, and not have a lot of heavy upholstered furniture or heavy drapes. You want washable or at least surfaces you can wipe off easily.
Now, you mentioned that the mites like to live inside the mattress. What about foam? It's become quite popular. There are lots of products on the market. Can mites live inside foam?
Actually, they can, the older foam rubber products, but some of the new types of foam, the memory foams and so forth, it's dense enough that you don't really get into the problem with mice living inside those types of mattresses. And one way I've been told by a mite expert, who's a friend of mine, you can tell, just take a little drop of water and put it on the foam. If it beads up on the surface and doesn't soak in over a few minutes, that's a way to tell if the foam is dense enough that it won't harbor the mites.
What about humidifiers? Can they be helpful or harmful when it comes to mite control?
I'm glad you asked me that, because humidity is another key factor for dust mite control, and that they like high humidity. As a matter of fact, they can't survive when the humidity gets below 40 to 50% for any length of time. So another method is to keep your humidity low, and certainly don't run a vaporizer or a humidifier to bring your humidity above that level. We don't really recommend using vaporizers or humidifiers at all because of that issue. If you're not sure, and sometimes it's hard to tell how damp your house really is, you can purchase a very inexpensive, what I call a humidistat. They actually measure the humidity and move it around your house, especially keep in your bedroom, to see what your humidity ranges are. If you find that consistently the humidity is above 50% or hovering in that range, it's probably a good idea to think about a dehumidifier. Other things you can do to lower your humidity is make sure you use your vents when you cook, when you shower. Anything that produces humidity, you want to try to remove and vent it outside the dwelling.
Is there a role for special filters on your HVAC system? Is this something you recommend?
For dust mites, the filtration probably doesn't make a big difference because they're localized. But for animal allergens, mold spores, and certainly pollen that may get in the house and float around, there have been studies showing that they actually collect on high-efficiency furnace filters. There's also evidence that if you put a HEPA air cleaner in a bedroom, that has some effect on the amount of allergen in the air. But you can't expect the filter to override high production or high levels of anything. So it's important to try to work on one side to reduce the levels, and also use a filter to remove anything that becomes airborne.
What about a vacuum cleaner? We've heard that some of the vacuums that are out there actually end up spewing allergens throughout the house and making things far more problematic for people with allergies or asthma. Are there filters that you can get for your vacuum cleaner that would prevent that from happening?
Well, that's one reason we recommend smooth surfaces as much as possible. We can use something just to wipe them down. But if you have a carpeting or you need to vacuum, say upholstered furniture, the types of vacuums that are available, that you want to either have one that has the type of hard shell chamber that the dust goes into, or the second type would be one that has a HEPA HEPA filter on the outflow. If any vacuum, they have to have an exhaust. So you want to contain the dust that you're vacuuming up inside the bag, and also or the canister. It's also important to empty those things outside the indoor environment. In other words, this is dust you don't see, you can't see, that causes the problem. But doing it outdoors or directly in the container, the disposable container, you're going to have a better outcome.
You mentioned HEPA, HEPA filter. What does the HEPA stand for?
Stands for high efficiency particulate accumulators, actually developed many, many years ago by NASA to reduce particulate accumulation. So, again, they have a very high airflow resistance, so they're generally not you can't use those on central HVAC systems, but you can use them in room air cleaners, and they're used in vacuum cleaners to reduce the amount of dust that's spewed back out into the air.
So let's assume that we have done everything we possibly can to control our environment, but we're still suffering. And we're not willing to give up the cat, the dog, or spend a lot of money changing our heating and air conditioning system. So we often turn to medications. Number one, antihistamines. Number two, we now have the inhaled corticosteroids. People think that they're the latest and greatest. We have decongestants. How do we pick the right treatment with the least number of side effects?
Well, in the past 40 years, we've had a development of a lot of really good medications for allergy and asthma patients. We've, in our practice, participated in the clinical trials dating back into the late 70s. So I've been involved either directly or indirectly in practically everything that's come along. I think if we look at back to the general population of maybe 1/3 of patients or individuals who have allergy, when we do these studies, oftentimes they're focused on large groups of patients, and they look at the outcomes. And for the approval to occur in these drugs, you have to have a difference between placebo. So generally, if you look at, let's take antihistamines, it generally around 30 to 35% of individuals get better on the antihistamine, and there's a difference, enough of a difference between that and the sugar pill, if you will, that the FDA in this country will approve the drug. And actually, our FDA is much more rigorous than some of the drugs that may be approved in other parts of the world. So now the medication's out where people can go to their local pharmacy and purchase it over the counter, maybe. But remember that only about 30 to 35% of people did better on it. So either they need to move on to a second medication, or even then, the nasal sprays, the nasal corticosteroid sprays, are a little bit better than the antihistamines. They often get up to around 40% of people got better. So what the bottom line happens here is about half the people or more don't really get good relief, even when they take a couple of these medications together. And that's when they need to, consider taking steps to get further care. But for about, the people that have mild allergy, oftentimes one or the other or both combination of these two medications can give them reasonable relief.
Dr. Sublett, I think a lot of people are familiar with the idea of allergy shots, but very few of us know exactly how they work or how well they work. So I'm hoping that you can tell us about immunotherapy for allergies.
I'd be happy to discuss that. When we approach allergy, a patient with allergies, I describe them as patients like a three-legged stool, and we've talked about avoidance measures, and we've talked about medications, and the fact that medications are helpful for maybe 1/3 to 40% of patients that have allergies. And certainly avoidance should be used for everyone. So the very important third leg is allergy immunotherapy. There's actually two types now. The traditional subcutaneous immunotherapy we call allergy shots, and there's a newer type that's been released just in the last couple of years and approved by the FDA. It's a oral form, very selected for pollen, and I'll talk about that in a minute. But looking at allergy shots, or what we commonly call allergy shots, what those are once you've identified what an individual is allergic to, these are extracts of the allergen purified and at a certain dosing, and we start out very dilute, and we rapidly build those up over time to where you can then have response by the immune system. What it really does is turns down or turns off the immune response to the allergy, and it's like a vaccine in the way it works. So these are very specific. So if you're allergic to, for instance, cat, we can use cat allergen to treat a patient, and over a fairly short period of time, just a few months, they become far less allergic. So it's kind of like taking a rheostat and dimming it all the way down to where it's nearly completely off. The reason we can't call it a total cure is that this is all controlled by our genetics. And at this point in time, we can turn it way down, but we can't turn the switch all the way off.
We have heard of allergy shots, especially for people who have life-threatening allergies, for example, to a bee sting or a wasp sting. And if they get stung, they go into anaphylactic shock in a few minutes and literally can die. How effective are allergy shots for situations like that?
Oh, they're very effective, to the point that, to my knowledge, and the last time I reviewed the literature, there's not been anyone die from stinging insects if they're on allergy shots. So the allergy shots are very effective. And we see, even with pollen or dust mite or cat allergen, the ones we use, 85% or so effectiveness, where you have really, we talked about earlier that with antihistamines, for instance, maybe 30-35%. So we're moving up to a range of 85% effectiveness in reducing the allergy response and symptoms. And the important thing to note, the difference between the medications we use, as we use those, they give you symptomatic relief, but they do nothing about the underlying allergy response. For the allergy shots, actually change the response and turn it down, and it's through a very complicated mechanism in the immune system that they're able to do that.
You're listening to Dr. Jim Sublett, president of the American College of Allergy, Asthma, and Immunology. He practices in Louisville, Kentucky.
After the break, we'll find out about non-drug approaches for allergies.
Can yoga help with asthma?
We'll also talk with Dr. Leonard Bielerai about complementary supplements such as quercetin, vitamin C, and capsaicin. Would you want Tabasco up your nose?
You're listening to The People's Pharmacy with Joe and Terry Graydon. If you're enjoying this People's Pharmacy podcast, why not head over to our website where you'll find a wealth of information on medications, conditions, home remedies, and ways to keep yourself healthy. You'll find it all at peoplespharmacy.com.
Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is brought to you in part by Red X Industries, makers of Utterly Smooth Foot Cream with shea butter, helping dry, cracked feet feel soft and smooth. 800-345-7339. The website is uttercream.com.
To order a CD of today's show or any People's Pharmacy broadcast, you can call 800-732-2334. Today's show is number 1006. That number again, 800-732-2334, online at peoplespharmacy.com.
We're discussing allergies today. Can the misery be avoided? How can the symptoms be minimized?
Our guest is Dr. James Sublett. He's a board-certified allergist in practice in Louisville, Kentucky. He's the managing partner of Family Allergy and Asthma in Louisville and the current president of the American College of Allergy, Asthma, and Immunology.
Dr. Sublett, I'd like to switch gears a little bit right now and ask you about non-drug approaches to treating allergies.
Well, because of the immune response, I mentioned, again, in our first part of our segment, we talked about some of the underlying reasons people may have a higher level of allergy problems than maybe we did 50 years ago. And I mentioned lifestyle. So I think the important thing to emphasize is having a good, healthy lifestyle could be potentially protective for not only you and perhaps your children, because the allergies are genetic, and we know that some of these mechanisms actually start switching in the mom even before the babies are born. So we've mentioned diet, so having a good, well-balanced diet can be important. Obesity is a risk factor, especially for allergic or asthma, and it's also been shown to be a risk factor for other types of allergy. So trying to keep a active lifestyle with exercise and a balanced, low-fat, especially low-carb type diet could be helpful.
What about yoga for asthma?
Well, yoga goes back to a healthy lifestyle. I think that if you, any form of exercise, and certainly yoga is a reasonable form of exercise that can be beneficial. There have been some interesting studies looking at deep breathing, not particularly just in asthma, but in other respiratory disorders. And there's kind of a memory that's built into our respiratory tract in our lungs. And they've shown that people that have deep breathing type exercises actually expand their lungs enough that they increase their lung capacity. And again, none of these things stand alone. So if you go back to obesity, it's felt that maybe one factor in obese individuals that may predispose them to develop signs of asthma is just they don't breathe as deeply. They're more sedentary, and they just don't breathe as deeply and as much as someone who's more active and has, does exercise to expand their lungs. So I think one of the components of yoga, and I'm certainly not a expert on yoga, but it is some of the breathing exercises may potentially have some benefit.
Dr. Sublett, what is the take-home message for our listeners? If 1 in 3 have allergy symptoms, is there hope for getting through allergy season? And I think what I heard you say earlier in the show was there's almost no such thing as allergy season. For many people, it's all year round, or at least 2/3 of the year. So is there anything that can help them breathe easier and not feel brain fog and feel so yucky when it comes to the allergies that just seem to surround us these days?
Well, I think there certainly is, and for children, for years have said that kids should be able to sleep, learn, and play, and you could apply that to the adults too. They should be able to sleep well and be able to go to work and be alert and perform well, and certainly participate in any extracurricular activities, especially physical activities they choose. So I think there is hope. I think we've covered most of these, but I think the real key is that for that 1/3 of patients that have allergies, if you're not being helped by some of the things we talked about, like the over-the-counter medications and trying to avoid things, and maybe using saline sprays to rinse your nose out, that seeing a board-certified allergist can really be a game changer, and they can identify what you're allergic to, help you prepare a targeted avoidance measures, help you with your choice of your medications, and minimize what I call polypharmacy, where you may be not having to take, a lot of different medicines. And then finally, we've talked about immunotherapy being a real, game changer again in those individuals who have significant allergies, and especially the things they can't avoid. So I think it's really a package of trying to, understand your allergies better, get educated. You can go to the American College of Allergy, Asthma, and Immunology website, or there's a website called Find an Allergist, Find Relief that can help you find an allergist in your area that can help. But there's just don't give up. There's certainly hope for those individuals who have these more significant forms of allergy or related disorders.
Dr. James Sublett, thank you so much for talking with us on the People's Pharmacy today.
I'm very happy to be here. Thank you for asking me.
You've been listening to Dr. James Sublett, president of the American College of Allergy, Asthma, and Immunology. He's a board-certified allergist practicing at Family Allergy and Asthma in Louisville, Kentucky.
We turn now to Dr. Leonard Bielerai, who will discuss some natural options. He's past director of the Rutgers University Asthma and Allergy Research Center and professor of medicine, pediatrics, and ophthalmology. He's currently conducting research on climate and allergic airway disease.
Welcome to the People's Pharmacy, Dr. Bielerai.
Thank you very much for having me.
We appreciate your time. We would like to explore some alternative approaches because I think right now a lot of people go to the pharmacy and they can access inhaled corticosteroids. So Flonase and Nasacort, very popular these days. They used to be prescription only. They can buy a range of antihistamines, some which are sedating, some which are not. But I think a lot of people are also looking for other ways to treat their allergies. Any suggestions?
Well, there are multiple ways to think about this, but one of the terms you use, and I want to get clarification for everybody, is that it's really not alternative. People are, quote-unquote, using this complementary, meaning it's rare that a person is only using these type of agents in that regard. Agents that can be used or have been used in studies, one of them, for example, is bebitastine, where these are a type of antihistamines, but the betasties are a derivative of a plant of which they found to be equivalent to antihistamines such as bebitastine and cetirizine. It had antihistaminic potential. And that has been studied actually in a head-to-head study where they compared these items. And there was some antihistaminic impact. There are other agents from the use of fenugreek, from the use of spirulina, which is a type of seaweed, to develop some other agents. Now, one has to realize that whenever you take these herbals, which are the primary components for many of these thoughtful complementary treatments, is that they're not standardized. And with the lack of standardization, you really don't know from store to store, lot to lot, what's going on because of the harvest. If people will realize that a pound of coffee at a certain, what we call Blue Mountain, I've heard, where it's grown on one side of the mountain, it's $50 a pound, and yet on the other side of the mountain, the coffee could be $1 a pound because of the nutrients, the sunlight, the geographical and geological materials that are for nutrients. So until we develop hydroponics, which will really standardize the item, such as being done in Israel, many of the herbals that are trying to be grown there are looked into hydroponics where they are standardized, and therefore the content is looked at.
I would like to ask you about a actual drugstore medication called cromolyn, which originally came from bishop's weed. And this product actually stabilizes something called mast cells, which are often responsible for a lot of the symptoms of allergy. Any thoughts?
Yeah, it's not an anti-allergic that you can use after the effect, meaning if you already had the reaction or you're sneezing right now, it's not going to blunt it within 15 minutes. The mast cell is already, the allergy cell, the mast cell, which you rightly described, has been triggered and has released its preformed mediator. It stores histamine in it, and it opens up and releases it. But it has other mediators in it as well that releases what we call prostaglandins and leukotrienes. And if you look at the classical treatments for that, well, you would take an antihistamine for the histamine release, and you would take a steroid for the prostaglandin and leukotrienes. But we also have now, almost surgically on a medical way, Singulair, which is a specific problem, montelukast, will actually inhibit leukotrienes component of it. If that is your mediator of prominence in your condition, meaning some people are very sensitive to histamine, some are more sensitive to leukotrienes, some are more sensitive to prostaglandins, so they have different impact on an individual. In general, histamine is the primary allergy chemical that causes the itching and the sneezing, but there are others that complement them in that way. The use of cromolyn is fascinating, is that you have to use it regretfully several times a day to stabilize the mast cell, to maintain its stabilization, and you got to use it for a week or two or three before you are exposed. So if you know your allergy season's ragweed down in the southern states, you're going to have ragweed exposure by the end of August. So you would need to start taking your cromolyn, quote unquote, whether it's a nose spray or eye drops or inhaler for the lungs, approximately by August 1st. To start prepping and coating those mast cells to stabilize them. Another component for that is that so you need a prophylactic treatment, but it does blunt it, and has shown that. Additional items have been antioxidants, such as quercetin. That has been extensively studied. Dr. Elliot Middleton, who believed in the ability of quercetin, bioflavonoid-type materials, to also inhibit the allergic response.
Now, there are a lot of plants that contain quercetin, aren't there?
Yes, there are.
And how do you spell quercetin?
Quercitin. And a study done posthumously, regretfully, that was completed for Dr. Middleton was done by Dr. Theorides at Tufts University, in that he actually showed the impact of quercetin as a sole entity and its impact on mast cell activation. And indeed, it does inhibit, to a degree, not only mast cell release of histamine, but other inflammatory mediators that are derived from the mast cell that leads to other aspects of the allergic response.
I wonder about nose spray that has a dilute solution of capsaicin, which is hot chili pepper.
It actually seems like about the last thing you'd want to put in your sneezy, suffering nose. I mean, hot pepper extract. Yikes.
True. Number one, it's a neuropeptide inhibitor, and neuropeptides are involved in allergic response and release of additional mediators. However, you are absolutely correct. At a certain concentration, depending upon the individual, you can reach an irritant response. That capsaicin is Tabasco sauce, as you well, and that's probably the highest concentration that you can get over the counter is in Tabasco sauce. It's also found in a treatment for zoster, the shingles that people get pain from, because it depletes the nerve endings and anesthetizes them. So that's how it works on the shingles pain process. And I always tell people, if the prescription is not doing its job, buy Tabasco sauce. It will sting when you apply it, but then it will anesthetize and give you some rest for a duration of time. When you apply capsaicin to the nose, depending upon the concentration, and you want the lowest concentration possible in this regards, because of, as you correctly stated, it stings. It has an irritation effect. But it stings when you apply, but then eventually anesthetizes the process. I do use capsaicin mixed with a solution that I have called Sinusol, which is a combination of menthol, eucalyptus, as well as cinnamon and spearmint and a variety of other ingredients. I have a Sinusol without capsaicin and a Sinusol with. And it's a nasal lavage that has again, a variety of properties that keep a healthy mucosa as component. Because if you look at menthol as an example, menthol itself is a decongestant. If you inhale menthol, it's an aromatherapy. You will actually vasoconstrict. You will cause vasoconstriction. So it works like a decongestant component.
Dr. Biellerai, there are some studies that go way back, they probably weren't very well controlled, suggesting that vitamin C might have an antihistamine effect. Your thoughts?
Well, I did a major review on that topic a number of years ago, about 15, 20 years ago already, on vitamin C and allergies in general, and it's an antioxidant. It probably works through that mechanism, not clear. It was used for the treatment of asthma and other allergic-like disorders, not atopic dermatitis, but it showed to have a trend toward positive but never reached a real clinical impact. And that's probably due to vitamin C being water-soluble. You can only take so much before you start just literally peeing it out. It doesn't reach a higher level than that, whereas vitamins A, vitamin D, vitamin E, and vitamin K are fat-soluble, and you can now raise it to a level, and you can actually get toxic on that. Whereas vitamin C, it's almost impossible to get a toxicity to it, because anytime you get it to a certain level, it literally goes, you pass it out through your urinary tract system.
Dr. Leonard Biellerai, thank you so very much for taking time to talk with us on the People's Pharmacy today.
You're welcome. I hope it was quite helpful. If people need more information, please let me know.
You've been listening to Dr. Leonard Biellerai, past director of the Rutgers University Asthma and Allergy Research Center and professor of medicine, pediatrics, and ophthalmology. His research focuses on climate and allergic airway disease.
Earlier, we spoke with Dr. James Sublett. He's a board-certified allergist in practice in Louisville, Kentucky. He's the managing partner of Family Allergy and Asthma in Louisville and the current president of the American College of Allergy, Asthma, and Immunology.
Lynn Siegel produced today's show. Al Wodarski engineered it. Dave Graydon edits our interviews.
The People's Pharmacy is produced at the studios of North Carolina Public Radio, WUNC.
The People's Pharmacy theme music is by B.J. Liederman.
The People's Pharmacy is made possible in part by Red X Industries, makers of Utterly Smooth Extra Care 20 Cream with 20% urea for extra skin protection. The number is 800-345-7339. The website is uttercream.com.
To order a CD of today's show or any other People's Pharmacy broadcast, you can call 800-732-2334. Today's show is number 1006. That number again, 800-732-2334, online at peoplespharmacy.com.
When you visit our site at peoplespharmacy.com, you can check out prescription drugs, herbal medicines, and home remedies. You can also share your own experience and your thoughts on today's show. Do you have an unusual way of managing allergy symptoms? We'd sure like to know about it, so do drop us a line.
When you go to the website, you can also sign up for a free online newsletter. It's delivered twice a week, and you will get it in your email. You can also subscribe to the free podcast of the show. You'll never miss another People's Pharmacy program again, and you can also share it with a friend. It's all there at peoplespharmacy.com. In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you so much for listening today, and please join us again next week.
We hope you enjoyed this podcast. If so, please consider taking a minute to write a review on iTunes. And thanks for listening to the People's Pharmacy.